So I have with me Russell Lusak. He's the Chief Operating Officer at SelfHelp. Russell, thank you so much for making time out of your busy schedule to talk with us today.
Well, thank you for having me here.
Welcome. So Russell, how about we start with a quick introduction about yourself and your role and your career so far, all the way to being the Chief Operating Officer of SelfHelp?
Sure. I've been around the block for a while, been working since 1995 in the healthcare industry. I actually started out working in hospitals. I was assistant administrator, administrative resident. Started at Mather Hospital as an administrative resident. Then I went on to be an assistant administrator at Astoria General in Queens. And then from there I began to grow into the long-term care space. Started out first working for a children's pediatric nursing home, then on into working for a geriatric nursing home, and then working in a CCRC, continuing care retirement community. I also had the experience of working in the Lombardi program, which is a nursing home without walls, overseeing an adult day healthcare program, social adult day program, overseeing diagnostic and treatment centers. And then where I am today at SelfHelp is overseeing as the Chief Operating Officer home and community-based services programs, which is inclusive of certified home health agency, a licensed home care services agency. Within those two home care programs, we provide paraprofessional care, we provide skilled care. So we have aides that go into the homes, and we also have nurses and physical therapists and social workers that go into people's homes under our home care programs. In addition to that, SelfHelp also has a very wide array of services that are community-based. We provide case management in all aspects of what we do on the community-based services side. And SelfHelp started in 1930s serving Holocaust survivors. That population, as it aged, we brought more programs to that population. And then we began to expand to the broader marketplace in New York City. So today we've got affordable housing for seniors. We provide services through 4 naturally occurring retirement communities. We've got 5 very active senior centers, 2 case management programs that provide services in people's private residences. And then we also have one of the largest community guardianship programs in New York City. And SelfHelp also prides itself on bringing services to people through technology. So the affordable housing complexes that we have, since they're our buildings, it gives us a wonderful opportunity to have a living laboratory to allow us to experiment and play with various technologies. And we've been a CAST founding member since almost 9 years ago. And we've been a great partner with Maj and the crew. And CAST has given us a lot of opportunities for us to meet new partners, and we have along the way. And today we developed the Virtual Senior Center, which has gotten a lot of look at through CAST. And the Virtual Senior Center is a way for us to get seniors connected to their loved ones and people they used to be connected with before they were homebound and alone. So it was born out of a senior center where the individual couldn't make it to the senior center anymore. And as a result, we built a virtual senior center for them to participate in the things that they love to do. So it was a great solution for us, and we've embedded it as part of our SelfHelp innovations, where we actually test various biometric devices. We've experimented with Quiet Care when Quiet Care was out, which is a remote monitoring system that tracked activities of daily living of people in their apartment. And now we have the Virtual Senior Center. So we've, me personally, I've grown from hospitals, and I've got the full spectrum of the full continuum of how to really take care of people that are either in acute stages of disease or in a chronic or even pre-acute stages of disease management.
No, I can definitely feel the energy and passion that you bring to this. So let me ask you this: there is a healthcare industry as such is going through a lot of change. Because of the administration changes, there is a lot of uncertainty in terms of what healthcare is going to look like in the future. Mm-hmm. So how is SelfHelp addressing or looking at this change, and what would be your advice to healthcare executives that are going through this process of change?
Pay attention to policy. I mean, it's easy to say it, but to really pay attention to policy, because it's the small things that you don't see they get you. And SelfHelp has been involved with a lot of policy changes, or in the right places, I should say, with policy changes in New York State. So we are positioned on statewide committees, and we listen for the little things. And right now, for us, we're looking at drastic cuts in Medicare, obviously, And with what's happening under the federal government with block grants potentially coming into New York State, it could be a major hit of $150, $160 million to our sector. So we are very, very mindful of what's happening in the area of policy. As far as executives and what they should be paying attention to, as the state's changing its methodologies for payment methodologies and moving more towards value-based payment away from fee-for-service, what's happening is the ball is moving from institutional care, an inpatient setting, into what the hospitals define as an outpatient setting, which is really a euphemism for home care for them. What the hospital's looking to do is to move their patients from an outpatient setting, brick and mortar, into the home, do it quicker, but also allow their staff to go into the home and actually visit them. As opposed to partnering with post-acute providers who exist in the community, they're trying to replicate what it is that we do already. And I only say that because of the rapport we have in the area of home care and in the area of community-based care, where we've got social workers and nurses who've been working with these populations for many, many years. A 7-day length of stay is not the same as a 5-year trust relationship you have with a client. So I asked, my executives who are my colleagues to pay attention to the policy to see, when you have this buy versus build mentality and you're trying to prepare for value-based payment, you got to pay attention to the policies that are impacting your operations the most. And for us, what SelfHelp is doing is a really deep dive in the area of data. And you really have to understand the populations that you serve. You have to understand how to identify the at-risk populations so that you can put evidence-based programs in place that allows them to stay at home and out of the hospital-based systems.
Oh, that's very insightful. So you've been a founding member of CAST. So what is the value that SelfHelp has derived from its association with CAST?
The value we have from CAST is the introductions that we have with technology partners. IBM, for example, Microsoft. In fact, early on with CAST, we met with Microsoft, and Microsoft helped us to develop the Virtual Senior Center. They gave us the marketing, they allowed us to kick it off. So I think the value that CAST brings to us is really having these opportunities to meet with the technology professionals in very intimate settings that we can really brainstorm and come up with ideas and suggestions that really could help out the population that we serve.
Makes perfect sense. And Russell, obviously you've been a very successful executive, chief operating officer, and there are a lot of young people that are getting into the industry looking up to somebody like you saying, how do we become successful like you? So what's your advice to the people that are getting into this industry with ambition?
First and foremost, they have to learn policy. They have to learn, what it is that makes our programs operate. Because without knowing the construct, it's very difficult to institute change. And this industry, the healthcare industry, is going through a significant transformation. I would say that for people entering this space now, they have an advantage that we don't have. Very early on in their life, they were introduced with technology. And they've played with technology since they've been 5. I have a 2-year-old who was playing with an iPhone when she was 2. Understanding how to turn it on and actually find ways to get into apps and play. And I think that's really important in our sector, because how do we leverage the technology that exists today to not reinvent the wheel, but to embrace what already exists and leverage it to make it work? So for example, wearable devices. That technology exists. You can track your pulse, you can track your heart rate. How do you take a wearable device and actually move it into the area of falls prevention? And the technology exists, and we can do that. In fact, we're experimenting with one of our partners to do that. I think also in the area of social media, the groundswell of getting people together very quickly through media outlets is something that is not as readily available or readily understood to the population that I grew up with. And I think social media outlets and social media channels allows you to really mobilize a team of people around policy issues a lot faster. And that's one thing I think that in the area that I come from, home and community-based services, people are homebound. You can't get them to Albany to advocate. You can't get them to really speak up for what they believe is right. So you're their voice, and unfortunately we're a smaller population for that voice. So I think the younger generation, the young execs coming up, being able to really leverage the technology they grew up with in a much different way would be very, very advantageous to this space.
No, well said. Russell, thank you so much.
Oh, no problem.
This has been a very insightful conversation. Thank you so much for sharing so many interesting insights with us. It was a pleasure talking to you. Thanks again.
Thank you.